Hey, I'm Dr. Adiaha Spinks-Franklin. I'm a board certified developmental behavioral pediatrician. And today we're going to talk about ADHD, Attention Deficit Hyperactivity Disorder. What in the world is ADHD? ADHD is actually a neurological condition that many kids are born with. It runs through the family like 70% of the time. Now, there are some other kids who develop ADHD, and they were born with conditions that put them at risk for later developing ADHD. For example, if pregnant parent smokes during the pregnancy, the chemicals from the cigarette smoke go into the womb and affect the brain development of the fetus. So when the baby is born, as they get older, they can show signs of ADHD. If a baby is born prematurely, that means their brain didn't finish developing inside the womb. So their brain is wired differently, and they are also at risk for developing ADHD as they get older. So what does ADHD look like? Well, it is a condition of poor self-control. That's it in the essence. You have a hard time controlling and regulating your attention span. You have a hard time controlling and regulating your activity level. And you have a hard time controlling and regulating your impulses. So difficulty regulating what you pay attention to, what you can tune out, when you need to hyper focus and really concentrate hard, and when you need to take everything in around you. Folks with ADHD actually can pay attention. What they have a hard time is selecting and controlling when to concentrate and tune things out around them when something isn't as interesting to them as their favorite activity is. It is a condition where you have a hard time controlling your activity and your energy level. So people tend to be very restless and very active and very antsy, and they talk all the time, and they're like the Energizer Bunny. That is ADHD. Now, the impulse control is what gets folks in trouble because they do not control what they say and they don't control what they do. So it's more like ready, fire, aim, rather than ready, aim, fire. You act, you speak, and then you stop and think about the consequences of it. So what do we do for folks who have ADHD? Well, you got to think about the treatment triangle. What is the treatment triangle? Well, the treatment triangle is the rubric for comprehensive ADHD treatment. That means that we need to provide education. That means supporting that kid in school and all of the supports that they need in school for learning and behavior. It also means that the parents and the family need to educate themselves and learn as much as they can about ADHD. The treatment triangle includes behavioral supports. That means parents need to work with a licensed mental health provider who has expertise in ADHD to learn effective strategies for helping their kid with ADHD function well at home and in the community. And at school, you also have a behavior plan that is very positive. It's focused on encouraging the child and not punishing that kid and helping them to learn how to manage their symptoms within the school setting. Now, for kids who have mild symptoms of ADHD, that's usually enough to help them. But for those kids that have moderate to severe symptoms of ADHD, then having the behavioral supports and supports in school usually isn't enough. And that means that there are more chemical imbalances in the brain that's making their symptoms more severe. And those are the kids who will more likely need medications in addition to the school supports and the behavioral interventions that they receive. If you want to know more about ADHD, please talk to your child's primary care provider. And if you'd like to see a developmental behavioral pediatrician because your child needs a more detailed evaluation, then go to my website, adoptionandbeyond.co. It's been great talking to you today, and I hope you have a very healthy and happy and satisfying life. Thank you.